first assessment video, I did not put any vital signs, so I just wanted to add to it, to add the vital signs as well. So we're back. Mr. Holmes, I'm gonna go ahead and take your vital signs, okay? So let me put a little sanitizer on my hands. Okay. So what I'm gonna do is we're gonna take the vital signs. I'm gonna take a blood pressure. I don't exactly have a thermometer, so I would actually check his temp, and I would use one. Make sure that I'm using the appropriate PPE. So make sure that I put a cover on the thermometer so that I can check his temperature. It would be 98.6 degrees, so that'll be normal. And so I'm also going to check his vital signs, his blood pressure. So I'm gonna put this down, Mr. Holmes. And you can hold your arm out. I would make sure that it would be the right size and make sure also that it is in the right place. I would clean off my stethoscope with the alcohol swab before I would apply it to the patient. I would put it in his brachial pulse. I'm gonna hold it. I'm gonna go ahead and inflate it until I start to hear the first beat, and go a little bit above that, and then start checking his blood pressure. So I did hear the brachial pulse good. I would also check his respirations, make sure that his breathing is even and unlabored. His respirations, I would assess them for a full minute while watching him breathe, making sure there's good rise and fall of the chest. So after I would monitor him for at least 30 seconds and notice that there is good rise and fall. He's not having any difficulties breathing. His respirations would be at 18. His blood pressure would be at 132/80. I will report if there was any signs of hypertension, any symptoms that he may have, like a headache or blurred vision or any dizziness. And then also his pulse, as I mentioned earlier, when I checked his apical pulse earlier, it was at 88. So, and the rhythm for his heart was sinus rhythm. S1 and S2 were heard on auscultation, and then his temp was normal.